Recognize the Honourable Leader of the Official Opposition.
Madam Speaker, today I joined advocates outside of Province House urging this government to finally invest in birth control, saving us all valuable dollars. We all save. In British Columbia, there is an estimated $90 in savings for every dollar spent on contraceptive support. Nova Scotians don't need explanations or excuses. They need results. They want the same health care support that women and gender-diverse people have in British Columbia, Manitoba, Prince Edward Island, and the Yukon. My question to the Premier is, when can Nova Scotians expect this government to cover the cost of birth control?
I recognize the Honourable Premier.
Thank you, Madam Speaker, and we believe all Nova Scotians should have access to all health care services they need at that time, including access to birth control. We know how important that is. There are a number of mechanisms already in the province through the Family Pharmacare program. There's also a great number of Nova Scotians that have coverage through private insurance that cover birth control, and we know that people on income assistance having access to free birth control as well. So we're looking carefully at an arrangement with the federal government. We know some provinces have signed on to that deal, and many are saying, uh-oh, we wish we didn't. So we need to be very careful about these things and thoughtful, and we'll continue to have those discussions with the federal government. Thank you, Madam Speaker.
I recognize the Honourable Leader of the Official Opposition.
Thank you, Madam Speaker. Women in this province do not universally have coverage. For many women, it's more expensive to sign up for pharmacare than it is to get birth control, and they can't afford either. An ounce of prevention is better than a pound of cure. In this province, the government covers the cost of medical and surgical abortions, advanced endometriosis care, and women who present in crowded emergency rooms with complications like ovarian cysts. Paying for surgeries and emergency services are more expensive than paying for contraception. Will this government stop treating women's health care as an afterthought and make birth control free?
Yes.
I recognize the Honourable Premier.
Thank you, Madam. Thank you, Madam Speaker. I absolutely do not accept that this government treats women's health care as an afterthought. That is completely inaccurate and more than a little bit over the top, I'd say, Madam Speaker. We know that there are gaps in the system, and we'll continue to try to work to fill those gaps. We also know that there's an incredible amount of work being done. There's more to be done for sure, but there is an incredible amount of work being done. Thank you, Madam Speaker.
I recognize the Honourable Leader of the Official Opposition.
Contraception is health care for women and gender-diverse people, and they don't have access to it. There is an epidemic of gender-based violence in this province. All members of this House agree on that. Women and gender-diverse people living in abusive relationships deserve support. Every Nova Scotian should be able to live with safety and dignity. Covering the cost of birth control removes financial barriers, allows bodily autonomy. These are the things that abusive partners use and abuse to maintain control. And according to Access Now, women in Canada who face intimate partner violence are 2 times as likely to experience an unwanted pregnancy. In a province where gender-based violence is an epidemic, will the Premier take this step to help survivors?
I recognize the Honourable Premier.
Thank you, Madam Speaker. Thank you, Madam Speaker. And we know that many people do have access, but there are barriers to some. We do know that. We'll continue to work with the federal government to see what's available. We'll continue to look at options as we do with healthcare in general, Madam Speaker. And we'll continue to look for ways to support Nova Scotians overall, as we did, of course, with a $500 million tax cut, which unfortunately the NDP voted against. But we know there's a number of facets to supporting Nova Scotians, and we'll continue to do that. And I'm sure every time we advance something, the NDP will vote against it, as they always do, but we keep moving forward, Madam Speaker. We know there are gaps to fill.